Oh, there we go.
I
I think we're good. All
Yeah,
right.
you got it. You got it going.
Here I am, Charles Moscowitz. Thanks for joining me, everyone. My guest is Dr. Dennis Deurelle. Dennis, you're with you're a physician. You're an analyst. You a coronavirus analyst, and you just got back from a conference call with doctors around the country to talk about the latest in COVID-19 status and treatment. So let's
That's
go through it. What's going on?
well. I'm also a director, the executive director for American Physician Partners. We are in 19 states. We have 2,000 doctors, and so I lead our clinical team on how we're treating COVID across the country. What's going on is that we have approximately about 100 COVID patients right now. Most of them are in our hospital outside of Chicago, more than half of them. Of course, Chicago is a hot spot. And so what we're able to do is in our clinical platform, in our billing platform, we can track every single patient. We can track how we're treating them, and we're tracking their outcomes. And we want to learn from each other because there's a lot of fast moving parts in this pandemic. There's a lot of science that's kind of being thrown out there, but it's not rigorous yet. And so we're trying to learn from our internal experience. And I'm sharing what I know from the literature. So far, we're doing pretty well with our treatment. Obviously, out of our patients, we've had 8 deaths so far. But we've sent a lot of people home too. So it's changing every week. But it was a good call, and I lead that for our company.
Now, Dr. Deurelle, are you personally treating COVID patients?
I am not at this moment. I have a Florida license, and I had just got my Tennessee license. And as soon as I get privileges at our hospital in Clarksville, Tennessee, which should be 2 weeks, I'll be seeing them myself.
Okay. Now, you say that out of 100 patients treated at this hospital in suburban Chicago, 7 of them have passed away. What is the general protocol right now for treating these patients?
Well, let me correct that. That was across our entire country. So that's not just in Chicago. We've had 8 deaths out of all of our patients, out of 103 that we've treated. Those are not in Chicago. Some of them were, but I will tell you what our treatment is right now. If we can get it, we like to use the drug remdesivir, but it's very hard to get. You have to be in a clinical trial or get expanded access. So we've been trying to obtain that, but we haven't been successful so far. But New England Journal had a study that came out on Friday, 53 patients that looked very promising. They were critically ill patients, so that's our number one choice. Number two, if we can get convalescent serum, that's serum from someone that's already had it, that's our second choice. Most of our patients are getting treated with hydroxychloroquine and azithromycin. I don't like the data on that. A study came out from China just yesterday that was randomized controlled placebo that was not favorable for hydroxychloroquine. Of course, but there is data out of France and other data out of China that looked promising. So the real answer will come from New York when we have a lot more data. But right now we're still using it because we don't have evidence it doesn't work. We're just being careful when they have side effects to stop it early because of the data.
Right. Okay. Now, I understand that New York hospitals are presently using the hydroxychloroquine Zithromax combination, and that I think FEMA just released, I think it was 14 million doses of hydroxychloroquine to hospitals around the country. And that there's the danger with it, from what I understand, and I'm not a doctor here, but I mean, I'm trying to read up on it, is that in a small number of cases, it can have an adverse effect if people have a pre-existing heart condition. So I think that if someone is going in for this, they might fill out a form letting the doctor know if they have heart condition. And if they do, then would that not necessarily mean they shouldn't have it, but they should be carefully monitored.
Yes, That's exactly right. A lot of people are getting hydroxychloroquine, particularly in New York, and I hope that they're getting it inside the clinical trials because that's what we really need. We really need the data. But you're right. On your EKG and your heart rhythm, there's a section of the EKG if it's prolonged. So if there's a delay in that section, we can find that, and those patients are at high risk for having a problem on this. So before we put patients on hydroxychloroquine and azithro together, we're checking their EKG, and then after we start it, we're monitoring that interval, and if it starts to increase, that's when we're stopping it.
Now, have people been on this regimen long enough to do a perhaps an informal evaluation? Because I know that there are some, formal tests, as you say, like studies being done in New York, but so far, people have been on it. What's going on? I mean, is anyone being improving, or what's the status of it?
Well, I would say this, as I mentioned, there's a study in France. There's 2 studies in France that look positive. Mostly that was reduction in viral load. So it wasn't necessarily that they got better per se. It was more that when we tested them, their virus load went down. There was another study in France that showed that really didn't, that contradicted that. So we have kind of 3 studies in France. Then we have a study in China that looked positive, and then we have a study that looked negative. So again, that's the data today. In terms of my doctors and our patients, most of them, I would say 80% are on hydroxychloroquine and azithromycin. And it's too early to tell. Some of them are getting better, and some, we just don't know yet. So I'd say it's just really too early.
But I think that, the main concern is what is the downside to it? And the downside is that someone might have a heart condition and they have to be more carefully monitored. But there's no evidence that anyone has died from it, at least not yet.
No.
Except for that one case in Arizona where that guy took that, whatever, that tropical fish pond stuff that, But that was totally unauthorized. I mean, anyone who takes a drug like this is like a very serious drug. You need to be diagnosed, you need a prescription, and you need to have it monitored by your doctor.
Yes. Well, there was a death that I read about in Brazil, apparently in their study, and they stopped it. There were some side effects in another study that I saw that was stopped, and I believe it was in Sweden. But I have not, we certainly have patients that we have it on that we've stopped it because they prolong that EKG, that interval, and we've seen that. But if you look at it right now, what's interesting is that Plaquenil, hydroxychloroquine, has been used in lupus and in other patients for years.
Sure.
And so we do have some safety profiles for it in that population. What's interesting, though, is someone looked at it and they said, hey, why don't we look at all the lupus patients that are on it and see if they're getting COVID? And they're still getting COVID in this series. 20 of them had it. And so
I see.
The idea that it's protective, it appears in early data that it's not just in that group. But I think overall, we just don't have enough information. And therefore, until we know it doesn't work, we probably are going to err on the side of using it because of the risk-benefit ratio.
Okay. So then there's no evidence that it's a preventative. It's only the kind of thing that you would take if you, in fact, been diagnosed with COVID-19.
That's right. But there is a trial going on right now for prevention. So people that have been exposed, they can sign up and get in that trial. And of course, in HIV, we have a cocktail of medicines that we can give after exposure that's been shown to reduce that risk. And
I was going to ask you about that next, because a guest of mine told me that this HIV drug called PrEP is effective. I mean, I have no idea, and I don't think he does either, because even though he takes this drug, he's not a doctor, but he says that the drug would block COVID-19, and that he said he could go out and eat a COVID-19 sandwich and he wouldn't catch it as long as he's taking this drug. Now, I'm not recommending that. I'm just...
I don't know about that. I know that there's 2 things. There's a drug cocktail called ritonavir and lopinavir. And that's been shown not to work. Okay. I agree that those studies were negative. Now they're looking at another HIV drug, and that's probably the one he's talking about, but it's too early to say. I certainly would be careful with that.
Okay. And what about any timeline on the development of a vaccine?
Well, in my opinion, we're going to have a vaccine by November. I'm not sure it'll be available to everyone because we'll need a lot of quantity at that point. But we know how to make vaccines. This virus seems to be pretty stable. So when they look at the genes of this virus from when it was in China and from when it's come to the US, and it appears not to have mutated very much, which is very good because if a virus mutates, as you know, like influenza, we have to guess every year. This virus seems to be pretty stable genetically. Therefore, when you put all that together, how good we do now with vaccine manufacturing, I think we're going to have something by November.
And that could be taken as a preventative.
Absolutely, it's going to be taken as a preventative. But remember that the main part about a vaccine is showing that it's safety in a lot of people and that it works. That is, that you're immune and your antibodies go up when you take it. That's going to be the time. I think they really have the targets right now. It's just going to be the testing. And I also should say that testing for antibodies, I think we're going to find a lot more people have had COVID-19 than we think. The reason that I'm saying that is that in Boston, they tested homeless people and 30% were positive. And they were asymptomatic. And in New York, they tested pregnant women, and 15%, roughly 13.5%, were positive and didn't know it. And Iceland tested 10% of their country, and of the people that were positive, half of them were asymptomatic. So I think when you add all that together, when we do antibody testing, we're going to find this has been around a little bit more, and many people had it and didn't know.
And then what that tells me is that you can have a very large percentage of people who have this will never even know they had it, and it'll run its course, and they'll then have immunity.
Yes.
And then also another large percentage of people might have some mild symptoms, that being the case with a member of my own family, and then they're isolated for 2 weeks, and then they're fine, and they'll have immunity. So really, when we're talking about people who get extremely sick, that's like maybe 1 or 2%?
No, it's 20%.
Oh, it is? Oh, that's huge.
Yeah.
Okay, so that's big.
Yeah, 20% are kind of going in the hospital, and then maybe half of them are really sick. So, I would still say that, you're still, 80% are fine. They do great. 20% not so. And my own daughter, she lives in Brooklyn, and she called me and she said, "Dad, I have a cough," and that was the only symptom. She didn't have muscle aches or flu-like symptom, and I'm sure she had it. She wasn't able to get tested, but I had her quarantine, and so she's a lot of people are going to be in that bucket.
Yeah, I mean, the same as that happens to be the case with my own daughter, who came home from a semester abroad in England and had a cough, and she was sequestered for 2 weeks. And my wife and I literally moved out of the house because my wife is kind of high risk health conditions. And she's now perfectly fine. I mean, it was like it just went away by itself. So I think that's probably, as you say, that's the case with 80% of people who get it. And out of that, more than half of them never even know they have it. So we're talking about people who have to go to the hospital. So far, the drugs that you mentioned, ritonavir and hydroxychloroquine as the main drugs being used.
Well, yeah, it's called remdesivir. That's
remdesivir. Thank you.
Remdesivir, made by Gilead. Hydroxychloroquine, as I mentioned, with or without azithromycin. And then the other thing that we're doing is we're giving a drug called tocilizumab, and that's an inhibitor of the cytokines or the inflammation that happens. It really turns on our immune system to a high level, and that causes what we're calling a cytokine storm. Everything in our body is turned up. You get fever, and your body is fighting the infection in more than it should be, and now it's attacking itself. And our immune system is turned up to 10. And there's a drug called tocilizumab, and we're giving that to inhibit cytokines. And so far, that seems to work pretty well. From my own experience in our practice across, like I said, 19 states, but it's still too early. Another thing it's another thing that people are doing is, as you know, once you've had the virus, you make antibodies. So we're getting what we call convalescent serum from donors that have had it. And if I get it, if you've had it and I get your serum and you put it in me, then I'm going to use your antibodies to fight my virus. And that is available. That's available now. We're starting to use that in some of our hospitals. We've given it to one patient that I know of. I still don't know their outcome at this time, but look for more of that. And then the converse of that is for patients that have had it, please go ahead and give to the Red Cross. You can go to Red Cross in your area.
So that if someone has it and they've got the antibodies, their blood can be used to create a therapy for someone who's very sick.
That's right. And
that's encouraging.
Yeah, and that's been happening since the 1918 flu. I mean, we've been doing that. Okay. We did it for Ebola. We've done it for other influenza infections as well. And
so that's encouraging. That's kind of well-established medicine. Now, what can we do as a population who are not infected to try to protect ourselves? Is there any kind of a preventative, not necessarily a pill, but anything you can suggest that we might do to improve our strength against the possibility of this, or if we get it, to reduce the likelihood it's going to really be a problem?
Yes. I should mention that some of the studies in China use zinc, and some of the studies in China also used vitamin C. And so I'll be very candid. I take something called Airborne, which is kind of a multi-cocktail that has a decent amount of zinc in it, and I take vitamin C every day. And I think those are two things I probably would do. Some people have brought up the fact that you have quinine that's in tonic. And
that's right. That has hydroxychloroquine, a natural form of it.
Yeah. And so some people are drinking that, and I've been asked that in some interviews, and I think that's reasonable. But I think the most important thing to do is this: eat right, get a lot of sleep, exercise. Those things are going to keep your immune system at its most powerful. I think exercise right now, aerobic fitness is very important. We're admitting patients that have such low oxygenation. It's almost like they're running a marathon, and they have to endure the onslaught of this virus and have enough respiratory reserve to fight it off as if they're running a marathon or two. So I would say getting in aerobic shape, getting your lungs in the best shape possible to endure this onslaught, you're going to do better. Obese patients are not faring well. In fact, a patient that we're taking care of that's younger, that's having a bad problem is more obese, and that's because of the obesity. And now 2 trials came out yesterday that have showed obesity is definitely a big risk factor.
Okay, yeah, I've noticed that. And, generally speaking, I mean, if you improve your health and your immunity, you're going to at least be able to fight the thing better. I mean, I think a lot of people have various regimens. I, like you, I take a pretty strong dose of vitamin C, and I take zinc lozenges, and I also take a natural stem enhance. But there are some other things. I mean, we all have our unique little stuff like that we do. And I think that, frankly, it's more than a placebo. I think these things are effective. But ultimately, it's good health, good exercise, good diet, and lots of rest. So, yeah, that's right on.
But hand washing and hand sanitizer. And again, I know that goes without saying, but really touching your face, wearing a mask outside of, right now, there was a really good study in Nature that looked at the spread of coronavirus versus other viruses if you have a mask. And in both cases, aerosols and droplets, when you have a mask, they didn't have any spread. You couldn't detect it in this testing device. So I think wearing a mask for several reasons, it reduces the transmission, but it also helps you not touch your face and your nose. That's a portal of entry. And so I think good hand washing, face mask, those things are important too.
So now, in the middle of this pandemic, and I think at this particular week it's at its height, at least, hopefully it will start to go down. But in the meantime, what do you suggest for someone who does want to go out, maybe get groceries, maybe go to a takeout? How do you function in situations like that that can protect you?
What I recommend is to wear gloves and to wear a mask,
Okay.
and to wipe. If you're going to take, Publix, where we are, we have Publix. They're very good about wiping down their grocery carts. But I probably would want to wipe down a grocery cart as well. And just remember that when you take off your mask and your gloves, you just be careful to take them off where they're not touching your body, and then dispose of them, and then wash your hands and clean your hands with sanitizer. I think that's fine.
Okay.
I don't, you're not going to get this on your mail. You're not going to get this on something that somebody, delivered. I think if it's on cardboard and paper bags and things like that, then I think we would have had a lot more transmission of this. So I think you do the things I said and you'll be okay.
And what about like a reusable mask?
I think a reusable mask is fine, but you really want to be able to sterilize it. How do you sterilize it? It's difficult. There is a hydrogen peroxide procedure that a company out of Ohio is able to do like thousands of masks at once with this mist. I think if you can wash it, if it's a washable mask with, regular soap and water, and it's truly washed, and you can use a disinfectant along with that, even something like Lysol, I think that's going to be okay. You could also put it out in the sun, because ultraviolet light kills this virus, and also you can heat it in a stove or an oven, whatever, to 180, 200 degrees. But again, you got to be careful with that. I don't want you to start a fire. But those are all the ways that people are doing it.
And that brings me to my next thought here, which is that as the weather gets hotter, is the virus going to recede and perhaps disappear?
That's a great question. Typically, coronaviruses, this is a coronavirus. The thing to remember is that coronavirus normally causes a very indolent common cold that's not a big deal. And when you look at those viruses, they tend to wane in warmer weather. So those coronaviruses do worse with heat and with high humidity. They don't do as well. And so, will this one behave the same? I kind of think it will, because it's in a coronavirus family, but we don't know, because it really is a novel. That's why we call it the novel coronavirus. It is novel. It's a mutation. It moved from bats into an intermediary into humans. So we honestly don't know if that's going to be. I'm hopeful. I am hopeful that will be the case.
Very good. All right, Dr. Dennis Deurelle, let my viewers and listeners know where they can get more information about you and your organization.
Yep. Well, again, my group is American Physician Partners. I'm the executive director for hospital medicine for them. You can get my book. Probably the best way is to get my book on Amazon. It's Your Healthcare Playbook, Winning the Game of Modern Medicine. And that's probably the best place. I have a website, Dr. Deurelle MD. You can go there. And one more thing, if you don't mind me mentioning,
not at all.
that I developed an app that's called My Doc Replay. And this app allows you to record your visit with a doctor and then share it in a safe way with your family members. The reason this is important is that no visitors are allowed in nursing homes or assisted livings or hospitals now. And so if you download the app, and it's free, it's called My Doc Replay, and you record your visit with your doctor, you can share it then with your daughter out of state or a loved one. And we're using this now in nursing homes in Austin, Texas, so that their family can see the visit with their nurse practitioner and then see and feel like they're getting to communicate with their family.
Excellent. Really good service. All right. Thank you so much, Dr. Deurelle.
Anytime. Take care.
All right.
All right.